questions already lined up?
Yep.
Okay, good. Should we go?
You ready when you are?
Yes?
Yep.
Good evening, everybody. On this Tuesday night, we'll have a quick runaround and a discussion about traumatic brain injury. So, traumatic brain injury is a topic that we've spoken about. I want everybody who is interested in the topic to go to our website, tbimedical.com. We were able to publish a book through Amazon some time back, and it's on the website. It's a patient primer, a patient handbook on traumatic brain injury. It's a very in-depth topic. We're going to have a series of these discussions over the next month because we wanted to make it aware because given football season is starting, and it's an issue that we face in common day and everyday society. So with that, I'll have a small primer and discussion on what is TBI. Traumatic brain injury is a diagnosis when a person has had some form of head injury. You don't necessarily have to have loss of consciousness. It can be just a whiplash injury to your neck where the head has moved forwards and backwards, and you can feel lightheaded, dizzy, and confused. Ultimately, the diagnosis is made by persistent complaints that last several weeks and months that include headaches, dizziness, lightheadedness, and nausea, vomiting. Additionally, the idea of TBI occurs when we do a special MRI of the brain where we look for something called abnormal diffusion tensor imaging through an MRI DTI of the brain. All of these images of the MRI DTI are on our website called tbimedical.com. It's being posted on our chat, so you can always go there and take a look. It's wonderful pictures of how the DTI images allow us to look at the functionality of the brain. What is the difference between a routine MRI and an MRI done with DTI is a common question that I'm posed all the time. A routine MRI is like a regular camera taking a picture of your hand. It can tell you if you have 5 fingers, how the fingers look, and if there are any lines on your hand. It does not tell you if your fingers move because it's just a photograph. An routine MRI is like a photograph. An MRI DTI is like a video camera where you take a video camera of your hand. You can not only tell its functionality of the hand because it tells you if it moves and grabs and does all those things that a hand is supposed to do, but it also tells you the color of the hand, the number of fingers you have, and the lines on the hand, etc. So the MRI DTI not only gives you some anatomy but also functionality. That's why we like to look at the patients who have symptoms of traumatic brain injury which are persistent for several months after an event. Usually the events are things like car accidents, work accidents, trips and falls where you hit your head or whiplash your head in a sudden way, or sports injuries like skiing, football, boxing, karate, taekwondo, etc. can cause these kinds of symptoms. We like to evaluate patients with MRI DTIs of the brain. If an MRI DTI of the brain is abnormal and the patient does have some persistent mild symptoms, we need to treat these symptoms. These symptoms are usually in the form of difficulty in processing information, maintaining information, and difficulty in coordinating information can also be there. Most patients with mild traumatic brain injury are able to perform personal hygiene activities of daily living, and things like that, but are unable to perform complicated tasks. We find that the degrees of traumatic brain injury are either mild, moderate, or severe. The vast majority are mild. With the mild patients, it's very frustrating because family members are quite frustrated over the event because patients are unable to perform their activities of daily living, their functional activities, and they usually complain to their family members, and the family members see a physically fit person before them but are unable to comprehend why this person can't process 3 things at one time. Why do they keep forgetting to lock the door when they leave the house? These are all common complaints that we hear from patients, family members who have mild TBI. We treat these conditions of mild TBI with several forms of treatments. Medication treatment can help. The common treatments that are non-medicinal are hyperbaric oxygen therapy and cognitive therapy. Hyperbaric oxygen therapy is a interesting therapy. It is a hyperbaric oxygen tent. It looks like a big hot dog in which you lie down inside of it. You can watch TV for anywhere between 30 minutes to 45 minutes, and high levels of oxygen are breathed in by the individual for 45 minutes. They go to sleep there and they wake up. This done once a week to twice a week over time improves functionality of patients with regards to their fatigue, their cognitive skill sets, their cognitive coordination, and ultimately brings patients closer to their normal level of functioning. Usually they never become 100% normal. They become 80, 90% to normal. Cognitive therapy, also done in tandem, can push them closer to that 90% of normal level. Cognitive therapy is an intense therapy where they come to an office, sit in front of a computer, and are given cognitive tasks to do in front of a computer, like taking an SAT test for 1 hour or 45 minutes at a time, once a week for several months at a time. And over time, these scores are matched to see that there's a steady improvement. So in the beginning, if you're scoring on the 50 level out of 100, after about 6 months, you should be scoring closer to 70, 75, and after another year, you should be closer to 80, 85. So these are all the scores that patients usually get, and find that they're steadily improving with that, and ultimately realize that, hey, they are doing much better, but it's important for patients to put the effort and time into getting better. Once you do that, the chances of getting better are very high. I strongly suggest that if you do have friends, family, or yourself are suffering from mild traumatic brain injury, please seek out a consultation with a neurology center that is in tune to treating these patients. Many patients are walking around with this diagnosis and are being told by their family members that it's fake. Unfortunately, it's not fake. These are real issues because people, friends and family, see you as a physical person with physically looking good. You're able to dress, but you don't feel perfect. You always have difficulty in doing multitasking and activities that are important to being your normal self. So with that, I'm going to pass on the microphone for some question and answers so that we can discuss these. And I'm sure we have a lot of question and answers. We'll try and do some interesting ones on the mic, and then the rest of them we'll do it off mic, and it'll be answered to you on off mic. And we have on the TBI Medical website a lot of information. And if you do find some of the information useful, or you need more information, please email us. We'll be happy to get you more information.
Is it a common feeling from your experience with patients with TBIs that they experience a paralyzing frustration with simple tasks?
So the question is, do patients with TBI find paralyzing frustration? The biggest problem with patients with mild traumatic brain injury, not severe forms of traumatic brain injury, I'm not touching upon that today. These are patients who may or may not have had loss of consciousness, no hemorrhage in the brain, no bleeding in the brain, no skull fractures, just symptoms of headaches, dizziness, difficulty focusing, concentration, things like that. They have these symptoms which are persistent for days, weeks, and months. They find that they're working in a desk job, and their desk job requires them to handle 2 computer screens at the same time. One computer screen to write letters and etc., and one to look at other spreadsheets. They find that they're unable to do 2 tasks at the same time. This becomes a paralyzing event for them. So they end up doing one task at one point in time, stop that task, and go to the second task on the other computer screen. The classic symptoms that I always am affronted with is those patients who work on Wall Street. These are patients who are in the back of a yellow cab. They've been in a motor vehicle accident because the car got hit or something happened. They hit their face against the partition that is between themselves and the driver. They don't lose consciousness. They may bruise up their face. They may or may not have a little bleeding in the nose. They usually, get treated from an urgent care center. They're still feeling a little foggy, confused. They go to work. They come home. They tell their family members that, hey, they're still feeling foggy. They go to their general doctor who gives them typically a Motrin or Tylenol, and they feel less pain over time, but they still feel foggy, confused while they're at their desk. If you've ever seen any TV shows that show the Wall Street offices or the finances offices, they have desks or cubicles set up with 5, 6 computer screens. So they have to manage 6 or 7 computer screens sometimes. The complaint that I always get from these patients is that they're able to do their job, but they can't go from one screen to another rapidly. They have to sort of shut down their thoughts about one screen and then go to another screen. And this slows down their process of executing their work. This is almost, as you said, as the questioner said, paralyzing level of dysfunction. So it paralyzes patients, especially when they have to do multiple tasks. And that is very important. That's a subjective symptom that patients complain of. Please, if you have friends and family members who complain of this, don't take it lightly. Get them into treatment for this condition if they've had a traumatic event to the brain, such as hyperbaric oxygen therapy and cognitive therapy. That'll definitely help them. There are medicines that can be added on also. That's a separate topic we'll discuss. But that being said, these two are basic treatments that are non-medicinal that can help improve the patient's overall function over short periods of time.
I'm currently 9 months post TBI, and I've passed the majority of problems, such as speech issues, certain fine motor skills, etc. However, I'm slowly realizing that every time I get over one issue, it's seemingly another one pops up. In this case, I'm now experiencing vertigo. Is this a permanent thing, or will it eventually be back to normal, as if I was pre-TBI?
You're still within the first year post-TBI, so there are many symptoms that take beyond a year to resolve. Balance symptoms usually do not resolve 100%. They resolve 80 to 90% of the time. What does that mean? It means that if you were to have imbalance episodes once a week now, you'll find that over a period of 1 to 1.5 years from the event, you will still get some episodes of imbalance. You would have mentally been able to compensate for it by understanding that when you do get imbalance, you sort of sit down, sit in one place, close your eyes, and wait for the event to go away. It may take a couple of minutes. And it also, you will find over time, with balance therapy, there is a specific form of therapy called balance or vestibular therapy, which you can do, and which can be helpful in further reducing the frequency of these events and the intensity of these events. So if they were occurring once a week, after balance therapy, you will find that it'll occur maybe once in 2 weeks to once a month, and the intensity won't be for many minutes, rather a minute or two. So that's what we in medicine try to attain, a reduction in the frequency and intensity of symptoms.
There's certain mild things that I have problems with, such as scheduling. I find that something as simple as laying out my calendar is the absolute bane of my existence. Is this something that cognitive therapy can help you get better at?
Yes, organizational skills, like laying out your calendar, laying out your daily activities, laying out your children's schedule, laying out your family schedule, are all things that cognitive therapy teaches you how to do that in a more organized fashion where nothing slips through the cracks.
I found that since my TBI, I am less creative. Do you have any ideas on what I can do to help that?
The question is, are you less creative with regards to artistic issues or with regards to actual cognitive tasks? If it's due to a cognitive task at work, then it is important to be able to work with a cognitive therapist to train your fundamental skill sets. If it is due to some form of an artistic pursuit, then the only way to improve that level of creativity is to keep pushing the limits of your abilities on a daily or weekly basis. So that if you were, for example, if you were an artist painting one painting or one mural a week, and you were unable to do that in a week now, and you're doing it maybe once in 2 weeks or once in 3 weeks, keep pushing the envelope so where you bring your time down, and that ultimately will improve your creativity and your performance abilities.
I'm 6 months post TBI. I never received a DTI. Is that something that you believe I should receive as it may help my treatment?
Yes, a DTI is critical for identifying the various body parts of the brain that may be body parts of the brain that may be injured, causing the TBI.
Does a DTI show permanent brain damage or only damage that happened recently?
The DTI shows permanent brain damage. It does not, that has occurred due to a traumatic event only. That's what the DTI shows.
I had a work-related accident 5 years ago. I worked for a power company, and long story short, hurt my head and got a TBI. The TBI case is still ongoing through workers' compensation. In your experience, is this normal for a case to take 5 years?
Yes, unfortunately, in New York State, the workers' compensation carriers are and the judges are quite inundated with a backlog of cases. The case histories can last for years and years and years, unfortunately. Most of the cases, however, do finish within the first 7 years. At that point in time, the judge will ask you and your attorney to file a permanent impairment rating from your doctor. Your doctor and your neurologist has to be able to complete a permanent impairment rating at that time, and that impairment rating is to see your functionality that is impaired for the rest of your life, and that results in a monetary compensation by the judge. We'll do one more question and call it a day, guys.
How often do you find patients are misdiagnosed, whereas they actually do have a mild form of TBI, but they're diagnosed as even a mild concussion or something not serious?
Well, that's a good topic. I have not touched upon that on the initial thing in great detail. I would like to elucidate a little bit about that question. It's important to know that many patients with mild TBI usually come to us where they have been told that, oh, you just had a mild concussion and you're fine. And family members usually think that the person who's having these symptoms is just exaggerating their symptoms. So the family members are not so sympathetic to these patients anymore after a while. And that further frustrates the patients. Many family members try to explain to the patients that this may be a psychiatric condition. So we perform the MRI of the brain with DTI to make sure that the family members understand that this is a real physiological problem where brain damage has occurred. This allows the family members to understand the problems that it's associated with regards to the brain damage. And additionally, family members tend to be able to digest the process more. I find that without the information to explain to family members and other physicians, it is important that these patients not be labeled as a psychiatric condition or mild concussion symptoms, because they fall through the cracks. If they're aggressively treated with hyperbaric oxygen therapy, with cognitive therapy, with medications, then over time there is hope for people to get better. Otherwise, patients with these conditions will just languish in neutral and nothing will happen. With that, we're going to close the session. It was a fast session. Thank you all for your patience. If you do have friends or family who have mild TBI and are not fully diagnosed, please go to our website at tbimedical.com. It'll explain what are the different things that you should get done to get diagnosed of mild traumatic brain injury. Find a neurologist in your area, in your neighborhood, and then have that doctor get some of these diagnostic tests done. It's good for you to know what your problems are and get them to get you into a treatment program such as cognitive therapy and hyperbaric therapy if available in your neighborhood. With that, all have a nice evening, and we'll have more interesting topics in the coming weeks. Thank you.